Can cocaine improve sexual performance? Why do some men feel more confident, more disinhibited, even more sexual when they use it? And why, at the same time, do many of them experience weaker erections or even complete erectile dysfunction? Is it possible that something that initially seems to enhance your sexual experience is actually damaging your sexual function over time? And most importantly, what is really happening inside your brain and your body when you use drugs like cocaine? If you've ever asked yourself these questions, this is something you need to understand. Because the relationship between drugs and sexual performance is complex. It is not as simple as better or worse. It is about short term effects and long term consequences. I'm Dr. César Noval Font, plastic surgeon and medical director of Clínica NEF, with clinics in Spain, Miami, and Mexico. We specialize in penile enlargement procedures, including lengthening and girth enhancement, as well as gender affirmation surgery. On our Spanish YouTube channel, we have helped millions of people understand their bodies through clear, honest, and medically accurate information. This English channel has been created to help you understand your body, improve your sexual health, and make informed decisions based on real medical knowledge. Now, let's start with the brain, because sexual desire does not start in the penis. It starts in the brain, and specifically in the reward system. This system is regulated by neurotransmitters such as dopamine. Dopamine is responsible for motivation, desire, and reward seeking behavior. Now, cocaine has a very specific effect. It blocks the reuptake of dopamine, which means that dopamine accumulates in the synapses. This creates a powerful increase in stimulation, in motivation, in confidence, in disinhibition. Now, this is why, in the short term, some men feel more sexual, more confident, more willing to engage. But here is the key point: sexual performance is not only about desire, it is also about physiology. Now, let's talk about erections. An erection requires parasympathetic activation, vascular dilation, nitric oxide release, and stable nervous system coordination. Now, cocaine does something very important. It activates the sympathetic nervous system, the fight or flight system. It increases heart rate. It increases blood pressure. It causes vasoconstriction. This means that blood vessels become narrower. Now, this is the opposite of what you need for an erection, because erections require vasodilation. So, even if desire increases, the physiological capacity for erection may decrease. And this is why many men report high desire, but poor performance. Now, let's go deeper, because this is just the short term. Now, what happens with repeated use? The brain adapts. Dopamine receptors become less sensitive. Baseline dopamine levels decrease. This is called downregulation. Now, what does this mean? It means that without the drug, the system is less responsive, lower motivation, lower libido, lower pleasure. Now, let's connect this with sexual function. If dopamine is reduced, desire decreases. If motivation decreases, sexual interest decreases. And over time, this can lead to chronic issues. Now, let's talk about testosterone. Chronic drug use can affect hormonal balance, stress, sleep disruption, metabolic effects. All of these can reduce testosterone. And testosterone is essential for libido and sexual function. Now, let's talk about the vascular system. Chronic cocaine use damages blood vessels. It affects endothelial function. It reduces nitric oxide availability. This directly affects erection quality. Now, let's talk about the nervous system. Repeated overstimulation alters neural pathways. It changes how the brain responds to natural stimuli. And this is similar to what we discussed with pornography and social media. Now, let's talk about anxiety. Many users experience increased anxiety over time. Paranoia, hypervigilance, and anxiety is one of the main causes of erectile dysfunction. Now, let's connect everything. In the short term, increased dopamine, increased desire, reduced inhibition, but also vasoconstriction, reduced erection quality. In the long term, dopamine dysregulation, reduced libido, hormonal imbalance, vascular damage, psychological factors. Now, let's talk about a very important concept: the illusion of performance. Some men believe they perform better under the influence, but in reality, objective performance is often worse. Now, let's talk about other substances: alcohol, cannabis, stimulants. Each has different effects, but many share common pathways. Now, let's talk about recovery. Is it reversible? In many cases, yes. The brain is adaptable. The vascular system can improve, but it depends on duration, frequency, lifestyle. Now, what should you do? First, awareness. Understand the mechanism. Second, reduce exposure. Third, improve lifestyle, sleep, exercise, nutrition. Fourth, address underlying issues, stress, anxiety. Now, let me leave you with one key idea. What increases stimulation in the short term often reduces function in the long term. If you found this explanation useful, subscribe to the channel. Here, we approach male sexual health from a medical and professional perspective, helping you understand your body and improve your quality of life based on real science, not myths.